Good afternoon. Today I'd like to talk about two issues and two steps forward we're making in our fight against the COVID virus. The first is a proclamation I'm issuing today that will improve our health and safety guidelines for the hardworking people in the agricultural industry. And we'll have Alejandro Sanchez and LNI Director Joel Sachs on hand to answer questions and comments by Eric Nicholson of the United Farm Workers after my comments. After that, I'd like to tell you about our testing strategy, another of our steps to protect our long-term care facilities. I'm joined by Health Secretary John Weisman to talk about those issues, as well as Authority Deputy Medical Officer Carissa Fatinos and DSHS Secretary Cheryl Strange, and also Assistant Secretary for Aging and Long-Term Administration Bill Moss to answer questions that any folks may have afterwards. I'd like to address the over 100,000 people in Washington who are working in the agricultural industry. We know that your labor is so critical to providing food for all of us, and we particularly are thinking about the 1.7 million Washingtonians who have food insecurity today in Washington State. We know that the production of healthy produce comes from the hardworking folks on our farms and fields. So today's proclamation is providing clear guidelines for both employers and workers that has been asked for, and I want to express my gratitude for those who worked in the collaboration to produce these guidelines. That work was not easy, and I know that today's proclamation speaks to your advocacy and commitment. You know, it was renowned labor leader Dolores Huerta who said, "Honor the hands that harvest your crops." And our state boasts some of the best produce in the world, and that's because we've got some of the hardest working people in the world. And we certainly know that every time we eat, there was a hand that provided our sustenance. And so we know we have rich soils, we have diverse climates, we've got large-scale irrigation. But mostly we have hardworking people, both orchardists and workers and farmers who are responsible for harvesting over 300 different crops in our state. And I know some of these are the hardest working people around. I lived in Sela for a couple decades and knew many folks and saw many folks just doing this incredibly hard work, cold and pruning and hot in harvest. And frankly, these folks deserve more recognition what they do in our communities. So this crisis means we're fighting with our strength to help everyone, and today we're talking about agricultural workers. The task to come up with the right policies is challenging, from the fields to employer-provided transportation and housing and other congregate settings like packing houses. There's numerous points of risk for people who are working in agriculture. The striking workers in Yakima on the lines as we speak are clear in their calls that more needs to be done. We hear that message, and that's why we're acting today. So today we're announcing additional safety standards for COVID-19 prevention for agricultural workers across the industry. These standards built on the requirements set forth at the beginning of the crisis for all industries, with more specific provisions for the unique needs of this industry. This proclamation is going to protect workers in the fields, in packing houses for fruit and vegetables, and on employer-provided transportation. These requirements complete the remaining standards that really are necessary to implement a cohort model set forth in the state's previously released rules on housing. Here's how it works. Amongst the many things we're doing to protect agricultural workers, we need workers in small cohorts, not more than 15 people together, that are protected from exposure to other people working, whether in housing or during transportation. This model, if it's adhered to properly, can tremendously reduce the risk to agricultural workers because they're only exposed to a smaller group of people that it can reside and travel and work together. So this will help us, if there is an infection, to very quickly trace the source of that infection, isolate that person and this cohort. And we think this is a tremendous strategy for breaking the causal chain of this infection. This effort requires significant changes, and we realize that. This includes requirement for all workers to have access to facial coverings on the job when they're not working alone. The state has procured and distributed 135,000 cloth facial coverings to agricultural workers across the state so far. And large work sites will have roughly 4 times as many hand washing stations as they previously did, so workers won't have to have a false choice between effective hand washing and getting their job done. So that's a quick rundown of some of the summary of the work we're doing. I'd like to now turn to Joel Sachs for a few comments about our work. Joel.
Thank you, Governor. As you said, agriculture is one of our state's incredibly important industries. We must all work together to protect workers from known workplace hazards on the job, like the coronavirus. Now, while COVID-19 presents unique challenges in keeping workers safe, there are many things that can be done to reduce risks. The requirements the governor is announcing today build on the work we've been doing over the past several months and provide a clear framework for protecting workers through things like physical distancing, increased hand washing, cleaning and sanitizing, training and education for work that's done in the fields, in warehouses, and during transportation. We want workers to know that we're here for them. They can contact us if they have a safety concern or want to file a complaint. We've been taking complaints and, where appropriate, performing inspections, and that work will continue. We want to make sure that workers know their rights. So we've been doing outreach through radio, TV, social media, and partnering with the community advocates. At the same time, we want employers to know that we have a consultation group. So if they need help figuring out the best way to protect workers, we're here and we're ready to provide assistance. We've provided consultations to dozens of employers, and we stand ready to help even more employers and growers. Because now, more than ever, it's critical that growers and agricultural workers work together to promote safety and prevent the spread of the coronavirus. At the end of the day, we believe that everyone has the common goal of ensuring that we can all put food on our tables and also ensuring those who are doing the work every day are able to stay safe and healthy. Here at LNI, we're committed to playing our role in making that happen. Thank you, Governor.
Yeah, Joel, I wonder if you want to talk about some of the cohorting strategy, how that applies during transportation, and also some of the pre-existing requirements for residential safety while people are in an agricultural industry.
Sure. So one of the pieces that we've worked on over the past few months is identifying those things across all industries that need to happen to ensure workers stay safe, and then addressing many of the unique challenges that happen in agriculture. So we've promulgated an emergency rule that talked about reducing the risk of the spread of coronavirus for those growers who provide housing for their workers. And what we did in consultation with advocates and growers is to identify a variety of requirements that would need to be met, and then different ways that growers could potentially think about implementing those requirements. One of the ones that we hit upon, and that you mentioned earlier, is for those communities where a grower has made a determination that they want to provide, they need to or want to provide housing. If they create what we're calling a cohort, which is a group of up to 15 workers who would stay together in housing, stay together for their meals, stay together when they're working together, and then not have interactions with other groups. That would be one way of trying to protect the spread of the disease. And when they did that, that would then enable the grower to expand and address some of the requirements that we have around social distancing and some of our other requirements. So in many ways, the option for the grower is ensure social distancing, promote a cohort model that creates these small groups of workers that give them a little bit more flexibility as it relates to social distancing.
And does that cohort model also apply in the transportation of workers?
Absolutely. So as growers are providing transportation, if they have a cohort group, they're able to have that group sort of in a slightly more contained environment. Whereas if you're transporting workers that are not in that group, then the expectations are going to be to ensure social distancing when you're on buses and vans, wearing probably a higher level of facial masks to protect workers from the spread of the disease.
Great. Thank you, Joel. And we have Eric Nicholson of the United Farm Workers. Eric.
Thank you, Governor. It's an honor to be with you today. And Director Sachs, thank you so much to you and the hard work of everyone at LNI. United Farm Workers has had the honor to represent farm workers across the state of Washington for over 25 years. During the scope of our pandemic, we have been in active consultation with these essential women and men to find better ways to stand with them so they can continue to fulfill their duties of making sure that we here in this state and across the country every day have food to eat, as you have so eloquently spoke about, Governor. Through the course of those conversations, we have learned about growers that have gone above and beyond and learned about the best practices that they have implemented. And we want to learn from them. We've also talked with workers about fears they have, and these rules go a long ways in addressing many of the issues that farm workers have consistently raised with us. And for that, we are deeply thankful. Some of the key points. There has been ambiguity about social distancing. These regulations make it very clear that those measures need to be adopted or other substantive protective measures be implemented. The provision, as Director Sachs talked about, information and training. Many workers, women and men, essential women and men, are going to work today fearful. They do not know what's happening. They are not aware of the coronavirus, the impacts, or more importantly, what happens, God forbid, if they become involuntarily quarantined or get the virus. These regulations require the employers to train workers on their rights and their ability to file claims so they can be made economically whole if and when they have to stay at home. We also are thankful that these regulations require employer-provided masks. That has been a huge issue, is that workers have literally been scrambling, trying to find masks on a daily basis that are clean, that are going to protect them in the work site. These rules clear out that ambiguity and make it very straightforward, and on a daily basis, clean masks need to be provided at no cost to employees. Governor, you spoke about the hand washing facilities. Current regulations allow hand washing facilities to be over 4.5 football fields away from where workers are. We know the importance of hand washing. By reducing that distance by a quarter, we're making those hand washing facilities much more accessible to workers and making very explicit the expectation of hand washing no less than 5 times a day. And finally, the issue of transportation. As we looked at food production, we recognize that we're only as strong as our weakest link. And in the constructive conversations the United Farm Workers has had with farm workers, with our colleagues on the grower community, we've recognized in the middle of a pandemic, there are no sides of a table. It is a round table. And we need to pull together, and that is our chance to have the greatest impact, to flatten the curve and eliminate this virus. By taking the steps that the state has done to ensure social distancing and adequate measures are going to be addressed in transportation, we have now firmed up another link in our weak supply chain. And I just want to say, Governor, your words go a long way of affirming the essential work of farm workers. It has been difficult for many of our members who are very proud of the work they do to hear conversations and gratitude being expressed by the community for other essential workers, but many times farm workers have been left out. So a deep felt gratitude for that recognition, and the women and men we have the honor to work with are tremendously proud of the work that they do and very thankful now that there will be binding regulations to further protect them in exercising those duties. So thank you.
Thank you, Eric, and thank you for your leadership and your organization. They've been really helpful crafting these rules that have not been easy in the agricultural environment. And I want to thank some of the growers that have helped us work through this to learn some of the practices at work as well. I had a great grapefruit yesterday, and it was so good. I know somebody had a hand on that. I don't know who that was, but they certainly deserve protection. So I'm glad we've had a step forward on this, and we're not done in this regard. And by the way, I do want to point these out. These measures are very protective for everyone, including the growers themselves and their families, who are obviously really hard working as well. So everybody's going to benefit from this step forward. So thank you. Now I'd like to talk about our Washingtonians in our long-term care facilities, and these are some of our most loved members of our families. And I want to thank the people who've been working in our long-term care facilities. They've had some real challenges in a variety of ways to try to make it safe for their folks. And this has been a challenge, and they have risen to the challenge in many ways. And they've been so helpful. They've been helpful to our family in helping to set up a Zoom call with my 103-year-old. She'll get there. My 103-year-old mother-in-law. We've had some folks out at Ida Culver to set up a Zoom call with her, and we just really appreciate the courtesy and professionalism of people in these facilities, but we want to help them by adding some new measures of protection, and that's what we're doing today. So today our Department of Health is issuing an order that will begin required broad testing within our nursing homes and assisted living facilities in our memory care units. This is going to protect some of our most vulnerable residents, and we know why that is necessary. So I want to just go over some of the requirements now of this, and I'm glad we've now in a position to be able to add to the many things we have been doing already in our long-term care facilities. So under this order, all residents and staff in nursing homes will be tested within approximately 2 weeks, and that completion goal is June 12th. And all residents and staff in assisted living facilities with the memory care unit will be tested within about 4 weeks or by June 26th. Facilities that have already completed a COVID-19 prevalence survey of residents and staff on or after April 1st will be excluded from this because they've essentially already done it. We're also requiring facilities to test all staff unless there's a medical justification not to do it. And facilities will offer testing to all residents and required to administer tests to all consenting residents. Now, there are already tests being done under previous orders to test in each shift staff when they come in, including temperature checks, and we're glad we've already done that under a previous requirement. To help in this effort, our state is going to be sending test kits and personal protective equipment supplies to our nursing homes and our memory care facilities, both for staff and for residents. Right now, the Office of Financial Management is working on those cost estimates so we can make sure we get that job done. In addition, our state will pay the laboratory costs for those tests for staff only. Residents will, presumably their insurance will take care of those costs. If facilities cannot meet these requirements in the time frame, they need to notify us so we can work to solve the problems to get this job done promptly. Now, this is just one of the steps we've already taken, and I'm glad that we have been working on this for some time. Our state has already sent strike teams to these long-term care facilities to provide on-site assistance with testing and controlling infections. They've had assistance with PPE use in response to outbreak with distributions through our our Emergency Operations Center. And folks in these facilities have been in Tier 1 to have access to what has been a very restricted supply that we've been able to obtain from the federal government and other sources. We've also previously provided guidance on infection control, and DSHS has been doing recurrent inspections on adherence to these infection control procedures. On top of that, our state's provided technical assistance to long-term care administrators, as well as webinars for administrators and staff to really try to prevent the spread of this dangerous virus. We're continuing work on plans to provide interval testing so that we can have repeat testing as time goes on. So we're developing an interval testing strategy for the rest of the long-term care facilities, such as adult family homes and assisted living facilities without memory care units. So with a little more detail about this order, I want to turn it over to John Weisman, our secretary, and Carissa Fatinos, who's really provided some great talent in this effort. John?
Great, thank you, Governor. Appreciate those remarks. And as you said, our nursing homes house our precious elders, and we know that they are at high risk for COVID and bad outcomes from COVID. So continuing to build upon the work that we have been doing that you mentioned is our goal here. And I just want to emphasize that this work started even before COVID was identified in Washington State. We were doing some of those webinars in advance with the healthcare administrators, letting them know what COVID was, what the symptoms are, and what infection control procedures were going to be very important. And as everybody knows, very early on in the epidemic here in Washington State, we learned that nursing homes indeed were a high-risk place where there were a number of outbreaks and infections. Thankfully, over the last month and a half, since really March, we have really seen a decrease in the number of outbreaks in our long-term care facilities. And that really goes to the hard work that you were talking about the healthcare providers in the facilities who are providing good care, who are paying attention to infection control, and as they've had the access to the personal protective equipment, et cetera, have been able to better protect everyone. So this order, which goes into effect today, really continues our work and now allows us to focus on those nursing homes and assisted living homes with memory care units, allows us to focus on those that haven't had an outbreak. For us to go in, test everyone, make sure that we don't really have any asymptomatic infection in those facilities. And if we do find some, to be able to, much like what you were talking in the earlier segment, be able to cohort those residents and keep them, in a separate part of the facility from others so that we minimize the spread of any asymptomatic infection as well. So we are looking forward to working and partnering with our nursing home and assisted living partners out there to get this job done. We are excited to have the adequate personal protective equipment and now the testing supplies to be able to carry out this mission and to assure that everyone is successful in being able to get this order carried out, as you said, for nursing homes within the next 2 weeks and our assisted living facilities that have memory care units by the 26th. And the reason we're focusing on those units with memory care is that we do find higher infections in our assisted living facilities with memory care. And in part, that's because folks with memory care issues, and my mom had memory care issues and was in a home, tend to wander and, need to be able to move around as part of their daily living. And we know that increases the risk of infection. So we have been seeing more infections there, and that's why we are prioritizing that group of folks. So we are looking forward to these results and learning just how much asymptomatic infection we might have in a facility. And with that, I think Dr. Fatinos is now just on the phone. She's been having problems with video. So Dr. Fatinos, I'll turn it over to you if you are on the line. If you are, you might be muted.
I think she's having some technical difficulties, so hopefully we'll try to get her early today.
Not hearing her. I was just going to say, so we call this a point prevalence study, which basically means that by surveying all of these facilities in a short period of time, we can actually determine what percentage of our residents and staff in these facilities might have COVID-19. Which will help us understand just how much infection there is or the potential for spread. Again, the advantage of doing this right now is that we're identifying people who aren't necessarily showing symptoms because, as the governor said, we've been screening staff for symptoms, we've been screening residents for any respiratory issues, and hopefully quickly identifying anybody who might have symptoms suggestive of COVID and then getting them tested right away. And if there has been an outbreak, then going in and actually testing all the residents and staff at that time. So this really just continues that work. And I think that's some of what Dr. Fortinos was going to cover.
Well, thanks for filling in, John. If we get the doctor, raise your hand, doctor, we'll get you in. I had a couple comments, just a short comment before we stand for questions. One of the things that I think is really important to think about when we think about our loved ones in these facilities is that we can really protect them outside of the facilities. One of the things we can all do to protect people in these facilities is to try to reduce the rate of infection in the environment outside, because the more infection there is outside, the more it gets into these facilities. And it is very difficult. We're testing the staff. We've made the difficult decision to stop visitations in these facilities, but staff has to come and go. And the more infection there is in the broader the community, the more it can get into these long-term care facilities. I just point that out is that we can do things for our loved ones who are being cared for, wearing a mask when we go to the grocery store. That's a simple thing to do, but it's really can help us reduce the infection rate in the community so it doesn't go into these facilities. So we can all be really helpful to preserve life in these spots. I think this is a good order, but it's not the only thing we can do. We all have a chance to take care of our loved ones, many of whom are of advanced age and therefore the wisest amongst us. So we hope people can help out every way they can. With that, happy to stand for questions.
Question comes from Nick with AP.
Oh, hi. Are there any penalties for failing to comply with the farm worker protections, or can you summarize those?
Joel, you want to talk about that?
So under our occupational safety and health rules, there are penalties associated with violating both what's here as well as our standard rules. And those are calculated on a case-by-case basis by formula, and it typically can be up to $7,000 depending upon the nature of the violation, the potential harm to the worker, and the size of the employer.
I just want to note, if I may, that these sanctions are available, but we've had such broad-scale compliance with our orders to date. And I want to thank the business community. The vast majority of business leaders have protected themselves and their employees and their customers by complying with these rules, the vast majority. And there's been very few folks who've been non-compliant. Those folks tend to be the ones reported in the press, of course. But we just want to thank the people who run businesses. They've made some very difficult decisions to try to protect people, and we appreciate that. Now, we have had some folks who need some reminding, and they need to be reminded that there are fines if they do not comply with these safety rules, including being open when they should not. In the last few days, we've had a number of businesses that thought they were going to skate by and not follow these rules, and we had to remind them they'd be fined, and they indeed have shut down in the last few days. So we've had some additional health in our state. But it's a very small group, and I want to thank the business community for what they're doing.
Next question comes from Joe with the Seattle Times.
Two questions, one for the governor, one for Mr. Sachs. For the governor, a judge is expected to rule Monday on whether your stay-home order should be temporarily stopped. Do you have concerns about that? And is that factoring into whatever decisions you might release in the coming days on extending the stay-home order? And then for Mr. Sachs, I'm just curious to hear a little bit more about the guidance today. What in here is completely new? Because I know that some of your guidance was already out there, or is this just sort of formed up? Is it directives? Can you just kind of parse that out for us?
I'll go first. No, the fact that some folks have filed a lawsuit is not affecting our decision-making. We're making a decision based on the science and the data and the metrics and the advice we have from epidemiologists. and listening to people in the larger community and how this is working, that's what we're making our decisions on. We believe we're on very firm ground, both by Washington law, by statute, and also by the state and federal constitutions. And I feel very confident that we have complied with the obligation, not just a right, but an obligation for the governor to act to save people's lives. And that's fundamentally what we're doing. And I think people understand that in Washington. That's why there has been such a high rate of compliance, so people know how dangerous this virus is. And they know that we can actually do effective things, which we're doing. So now, having said that, I want to tell you, look, I respect people's right to go to court. They have a right to challenge decisions in our government. And thank goodness we live in a country where we have a good judicial system that can give the people the right to have these things reviewed. That's fine with us. But we feel we're on very good ground. We're making good decisions, and we're saving lives. And that's a pretty good day's work.
And Joe, thanks for the question. I would describe what came out today as building upon the work that we've done. So embedded in this are the things that we've already done, but there are a number of places where we articulate new requirements based upon some of the things that we've been learning over the last few months. So just a couple of examples. Eric mentioned one in terms of the spacing of hand washing stations. A second one is in this directive, consistent with what we've seen with other industry agreements, is the expectation that workers in the agricultural industry are wearing masks unless they're working alone. There's also some more specificity than we provided up until now around transportation. Because this is an industry where workers receive transportation from work site A to work site B from an employer. So we talk about things like making sure that the vehicles are cleaned after each time transportation occurs, or if you're sitting on a bus, that you're placed in a zigzag manner, or that windows are left open to the extent possible. So this is a building upon and creating some new expectations, but it's certainly consistent with what we've been doing over the last number of months.
With Q13.
Hi there. First, for the governor, we know that Snohomish County, even though they haven't met the case requirements, would like to seek a phase 2 variance from you. They feel that they've gone through enough economic pain, according to its leaders. Can you just react to whether that would be a possibility for Snohomish County? And then my next question is likely for Mr. Moss or Ms. Strange, but Dr. Weissman or Governor, if you would like to weigh in as well. I want to go back to early on in the outbreak. Is there any evidence that long-term care facilities before the governor's order that acted more quickly to quarantine its residents before any kind of order was given down, before any cases happened in those facilities? Did you find that those facilities that acted really quickly beforehand were able to stave off the outbreak, or really was it a matter of luck whether COVID entered a facility or not? Thank you.
Do you want to go ahead, John or Bill?
So thanks for that question. This is John Weissman. I don't think we really have any hard evidence of that. We do know that infection control procedures, when implemented, can be very effective. But, this whether or not a facility ended up with an outbreak does rely on a number of things. One was their virus circulating in the community. So we know that early on, for example, the Puget Sound area really is the place we think where, we had more virus to begin with. So facilities in another part of the state were at much less risk for that. And as the governor said, some of this, the infections, if residents weren't leaving the facility, which, they certainly were out in the community, but this infection could come in through visitors, it could come in through workers, somebody who had a visit at a healthcare provider, had to go out, or they were out on a tour. And what we're learning now, which is why this work is so important, that there are asymptomatic infections. That is, there is infection without any symptoms, and perhaps never developing symptoms. Maybe 25 to 40% of cases could actually be asymptomatic. We didn't know that at the beginning of this outbreak. This is a new virus. Previous coronaviruses didn't act that way. So in terms of early on, I think, it makes some sense that if you had good infection control practices in place, that certainly gave you a better chance of not having any infection. But it also became a difficult job when there wasn't enough personal protective equipment for folks, a difficult job when there was asymptomatic infection, and we didn't know that, and we weren't limiting visitors. So I don't think we have great evidence, that I could point to answer your question specifically, but it does make some intuitive sense that if you were better at infection control procedures, you had a better chance of having less COVID.
Yeah, in regard to Snohomish, under the current order, there is not a procedure for that. But in the next few days, we will have more decisions about June 1 and where we go from here. And I think some of that will be responsive to some of the concerns that some of the folks in Snohomish County have. We've had good talks with their leadership as recently as last night or night before last. So I think there'll probably be some pleased folks to some degree.
Next question comes from Jim with the News Tribune.
Governor, just to follow up on that, it sounds like that you're working on criteria for the larger counties. And then the second question, which would be, would you say to those who feel that both of these announcements are coming too late?
Well, what I've learned in this business of dealing with this virus is that no matter what decision you make, a lot of people think it was too early and a lot of people think it's too late. And we make the best judgments we can. We have been working on both these issues for some period of time. And I just want to reiterate, this is not the first thing we've done for these communities. This is just another step of the continuum of protecting people in agriculture and long-term care facilities. We acted fairly quickly to prevent visitors. We've had strike teams go out to these facilities. We've had many, many educational things in infection control. The state has provided PPE and test facilities for long-term care facilities. I just want to point out these things are just an ongoing part of our efforts. I do want to say that we have been frustrated in some of our ability to do some of these things, including this testing. So as you know, testing supplies have been in very short supply, including the swabs. As you know, we've had probably only a quarter of the swabs we need to actually test the nurses and the physicians and the firefighters and the police officers and the ambulance drivers and people in long-term care facilities. They are all in Tier 1. So everybody was in the same boat. There simply was not enough of this testing material available, and it's been very frustrating to all of us. And I may be the most frustrated person in the state about that. So had we had additional testing capacity, I think we could have done these things earlier, but that's been a great limitation. Now, the other thing is that the science has advanced. As John talked about, the science has advanced significantly in the last several weeks to show how prevalent asymptomatic transmission is. We thought that was a possibility, but it has now become a certainty, and particularly a higher percentage of transmissions appear to be from asymptomatic transition, which has increased in the last several weeks the need for this more broad-scale testing. So both the science has improved and the testing supplies have improved. I know you've heard my concern that we have not had the assistance in the federal government we wanted for a long time to get testing facilities. That has improved. We've got several 100,000 swabs that have been delivered in the last several days. So this has now enabled us to take these next steps. On the agricultural side, I think that we've got these things in time because, as we know, we now are having an influx of many more people into our state with the harvest season coming on. But we've been working diligently to take, again, the next steps. This was not the first step. This is one of many we've already taken in the agricultural facilities. We've already had protection in residential situations, in some social distancing and the like. So I would say that I'm glad we got this done, and we've listened to a lot of people in doing it. I think when we've developed this, and this has been a challenge, look, we're making decisions on an hourly basis with huge ramifications for people's lives. When you make decisions like this, you want to talk to people, and so we've spent a lot of time the last several weeks listening to orchardists and farmers and ag representatives and agricultural workers and doctors, and we've tried to get as much information as we can. I think we've come up with a really good product in really tough circumstances.
Next question comes from Essex with Cairo.
Yes,
Essex, I'm sorry, Essex, we can't hear you. If we can try a different avenue.
Essex, the same thing that happened last week is happening again. You have to pop off and then try again. Okay.
Thanks, Essex. We'll be back to you.
Okay. Next question comes from Carolyn with the South Seattle Emerald.
Hi. Yes. So I have two longer questions. The first one is for Governor Inslee, and the second one is for Director Sachs. Governor Inslee, last week the Seattle City Council passed a resolution asking that you create a relief fund for undocumented workers who do not have access to unemployment benefits and taxes. As we've seen, undocumented workers are among make up a lot of the agricultural workforce. Is your office looking into creating such a relief fund? And if so, what does the timeline look like?
Yeah, let me just answer that. Yes, we are looking at that. And I'm still trying to get a definitive answer whether or not the governor has the ability to do this without legislative action. We're still trying to nail that down. So we need to get that answer first, and then if the answer is yes, then to look at what the appropriate scale and scope and how it would be targeted. So we hope to have that shortly, and it is under active consideration.
Thank you. I appreciate answering that. And Mr. Sachs, so in late April, I reported on issues facing workers in agricultural packing warehouses in Eastern Washington. One of their biggest concerns was that LNI was not actively enforcing the requirements it had put out earlier that month, and that employers were frequently in violation of the requirements without repercussions. Instructing LNI inspectors to make more frequent visits to agricultural warehouses to ensure agricultural employers are following proper protocols. And then, if not, how will you be making sure they are? And if so, how frequent will the visits be? And what will the inspectors be looking for?
Thank you for the question. So we have been inspecting warehouses. We have a number of inspections that are currently open. And when our inspectors are going in, they're looking for the kind of things that we've been talking about. So is there social distancing? If there's not social distancing because of the nature of the job, what are the mitigations that employers are putting in place to protect workers? Is there enough hand washing stations? Are things being cleaned on an appropriate basis? Are workers being trained? So we have been doing inspections. We will continue to be doing those inspections. And for the warehouses that ask for it, we're also available to provide consultations. It's our belief that the more we can be working with both workers and with the employers is to identify best practices, good safety practices, and encourage collaboration between the workers on the front line and management in packing houses, the more likely it is that we're going to have safe working conditions across the state.
Next, we're going to go back and try Essex again.
Okay, hope you're hearing me better now, Governor.
You bet.
Would you clarify something from yesterday, Governor? And then I also have a question for the Secretary. Would you be clear about your position on Commissioner Levine? Does she continue to have your full confidence?
Yes. She and the department are doing a very difficult job now, and I think have had some recent success. I think she announced today that the department has been able to stop, intercept, or recover about $300 million from this criminal syndicate that is attacking America right now. We're not the only state being attacked. That's some good news. Under her leadership, the department has also been very aggressive in the last few days, putting in a host of other measures to reduce the risk from these criminal syndicates. And I have been advised of those, and they are multiple layered and they're technologically adept. I can't share those with you, obviously, because we don't want to tell the criminals what our strategies are, but I think they have been considerable. And it is a difficult thing the department's doing right now because it's simultaneously trying to accelerate our ability to get these payments out to people who are justifiably making claims. And this is extremely frustrating to people who've been waiting weeks to get their payments. And yet if we turn the dial towards security, every time we do that, it slows down our ability to get those payments out to people. So that dial either goes to reducing the risk of hunger or it goes to decreasing the risk of fraud. And so they're having to make some really hard decisions. I think they've made some good ones recently to simultaneously try to get these checks to payment who are so desperate for these unemployment compensation benefits while simultaneously reducing the risk. And I think they are achieving both of those as quickly as possible.
And for the Secretary, with this additional testing, will care homes now be able to reopen to visits from families which have been so missed?
Thanks for that. What I think this will do is give us a sense of just how much asymptomatic infection is present in our facilities, and it will add to our thinking. We do know that reducing the number of contacts from folks who are out in the community certainly helps in this infection control. And we're also concerned, as the governor said, about needing to be able to have visitors and folks have that family contact. And it's a tough balancing act here that we're very sensitive to. We really do appreciate, as the governor said, the staff's efforts to help people connect electronically with video kind of communications and telecommunications. And that's been, an additional task that the staff have had to take on in those facilities. So we do continue to take a look at this, and going forward, we haven't made any decisions about how to best proceed, but this information will give us, this testing will give us additional information as we ponder the options out there for all of us.
Next question comes from Dan with Fox News.
Hey, Governor, last week you were asked about a report that found COVID deaths in Washington State may have been inflated some because of the methodology used by the Department of Health. You stood by the number and then said, quote, the problem is you get some people out there who are fanning these conspiracy claims from the planet Pluto. Today, the Department of Health statistics manager told me that they're in the process of removing cases where people tested positive for COVID but later died from something else. They know of 2 drug overdoses and 2 gunshot deaths and 30 other cases where people had other grave conditions like late-stage cancer or COVID was not listed as a cause or even a factor on the death certificate. I've heard no one say the actual number of people killed is okay or that this is a call to be irresponsible, as you claimed was said last week. Well, your reaction to that report suggests to some that you were the one playing politics with the science and data. How do you respond?
Well, listen, I guess what I would like to say is that the actual number of COVID deaths may actually be higher than has been reported because we have a number of deaths that did not take place in hospitals. There were not autopsies. No one knows the exact number right now. It could be higher. There was a description a few days ago by Dr. Lofi and others that suggested it actually could be higher than has been reported. Now, possibly it's a few lower. That possibility exists as well, I suppose. The point I would make is 2. It's to some degree irrelevant. Each one of these is a tragedy for a family, and hundreds of deaths is a pandemic at any number, whether it's 800 or 850 or 849. And I think, frankly, arguing about that, it doesn't change our ability to make really good decisions to try to change lives. And so I'm not focused on that. Others may be. I am not. I know that it is high enough that we need to act in responsible ways to reduce the transmission rate. I know that we have more work to do in that regard. And I just have to push back a little bit. You said that nobody has sort of attacked the need to deal with this. Well, in fact, they have. I think it's very regrettable that they have. We've had public officials who've called this a hoax. A hoax. We've had public officials who said it was going to be gone the next Monday. We've had public officials who've said that testing is overrated. In fact, we've had one very prominent politician say that. And that has been very damaging to our nation's ability to do what Republicans and Democrats need to do, which is to work together to end this scourge. And I can tell you that both Republican governors and Democratic governors have tried to convince the federal government to be a better partner to try to not spread misinformation about this. And so whether that's coming from Pluto or the White House, maybe is not that big of a difference because it's dangerous. Let me give you another example right now since we're on this topic because it's a very important one. We've had a lot of success in Washington because Washingtonians have been acting to really act to protect their families, both Republicans and Democrats. It's the reason we've been so successful in bending the curve down. We have huge compliance with our stay-home order. People are socially distancing. Business leaders are doing some good things to protect their employees in very difficult circumstances. So we've had a lot of success, but we're not done yet. And now we're trying to remove the social distancing so businesses can reopen and people can go back to their churches and the like. But we need to replace that with a new strategy to reduce the rates of transmission. One of the really important things in our ability to do that is wearing the facial cover and masks. And what the science is now telling us is it can be very, very effective when people wear masks in grocery stores, when we reopen our retail outlets, when you're in a crowded place. Those masks can be really, really effective. And unfortunately, we've had leaders, at least one, who are trying to convince Americans not to do that. That's really dangerous right now, and it's very unfortunate. So I am not shy about expressing an opinion about what endangers the 7 million people that I work for. I'm not intimidated by people who want to say that we're not going to protect our citizens. So I'll stand by my statement that there are those who are causing dangerous misstatements, and I will speak against them.
Time for a few more questions. Next question comes from Jim with the spokesman review.
Governor, a couple of quick questions for you. One is, do you expect the new rules for agricultural and food processing workers to end any labor disputes currently in central Washington? And then on the testing at long-term care facilities, will the public be getting the results of these tests broken down by the individual long-term care facilities?
To your first question, I don't know what impact it'll have on some of the labor action that's going on. I would hope that it will have improvements, certainly that people will recognize, but I haven't had conversations with the labor groups to know whether that will change their position. As far as the information long-term care facilities, John, do you want to handle that? Or Cheryl or Bill?
One of the things that's required is that as a facility gets a positive test, they are required to report that to the Department of Social and Health Services so we can track those and have that information, and that certainly is shareable information. And then the medical provider labs also report that to the Department of Health. And so we can compile those numbers, and we'll be taking a look at those and sharing that information as well.
Okay. Next, we go to Mai with the Yakima Herald.
Hello, thanks for taking my questions. I have 3 questions. I have one question for Dr. Wiseman. there was a strike team that came to Yakima Valley earlier this month to address outbreaks, including in agricultural facilities. I'm interested in hearing what that continued effort in addressing existing outbreaks in fruit packing houses. I have a question for Director Sachs, which is you've already done inspections at several agriculture facilities. I'm interested in hearing what follow-up you might be doing in light of the new regulations that have come out today and yesterday from Department of Health. And then I have a question for Eric. I'm interested in hearing, you guys filed a lawsuit with another union over enforcement and regulations. I'm interested in hearing how these new regulations address some of the issues that you addressed in the lawsuit. Thanks.
So those strike teams are exactly what we're talking about, where we can send out not only to long-term care facilities, but to work sites as well as being an important part. So the work is they go in, they identify what they know of the situation at that point, along with the local public health officials. They can recommend additional testing that we want to do, bring in the supplies so that they can have the supplies and the ability to get those to labs so we can get quick turnaround tests on those. Also look at what infection control practices are currently in place, what might need to be strengthened. Perhaps there were some practices that were just simply wrong, and being able to correct those as we go. And then as we do that, part of that is providing technical assistance to and with the local health department, the employer, the workers, to make sure that everybody can have the information they need. So the strike teams are really important. They were out there, both the Washington State Department of Health as well as Centers for Disease Control and Prevention were out working and in both long-term care facilities and in the food processing. And I think folks have found that very beneficial and brought in additional testing resources. So I hope that answers your question.
So this is Joel Sachs for your second question. Our intent is to continue down the path that we've been down, which is we will be doing some proactive inspections. We will also be evaluating and responding to complaints that we get from workers and referrals from other organizations, and partnering with growers and packing houses that ask for our help from a consultative perspective. In terms of the enforcement criteria that we will use, come June 3rd, when this criteria formally takes effect, when our inspectors show up and open a new inspection or begin a new consultation on June 4th, June 5th, they'll be applying this criteria. I also believe, because a lot of this criteria are things that are best practices, I suspect that we will find, at least in a number of facilities and on a number of farms, these things are already happening because growers have put them in place a few weeks ago. And we want to ensure that that's happening across the industry.
And then Mike, thanks for your question. On behalf of the UFW, not in a position to comment on the specifics of the lawsuit, but I can share with you that since the beginning of this pandemic, farm workers have been very clear with us that what they desperately wanted was clarification about what does it mean when the governor back in March spoke about the requirements of social distancing and adequate sanitation measures being in place at all essential businesses. With the promulgation of the housing rules a week or so ago now, and with these regulations on transportation and worksite requirements, in our talking with workers, we're feeling much better about having the clarity that they were looking for, so everybody knows what the rules are, they will be enforced, and hopefully the essential women and men who are keeping us fed can continue to do their jobs safely and without putting their families at risk.
Last question. Final question comes from Keith Lascamo.
Governor and Secretary Weissman, Pierce County just announced that they are perhaps taking 4 names off of the death list to see if they indeed were COVID related. If numbers go down in Pierce County, numbers go down in King and Snohomish County, might they have an easier time getting in if you lower the bar to deal with that? And what's to prevent all the people in those 3 counties from letting Sac County, Thurston County to possibly the virus with them?
Could you try that last part again? We broke up a little bit.
So what's to prevent people from King, Pierce, and Snohomish County from flooding the nearby counties that are already in phase 2? And the first part of it was Pierce County is rethinking 4 of their deaths that may not be correctability.
Well, fortunately, we have not experienced the kind of flooding phenomena, so we hope that that would not be the case. I don't think it has to date. We now have over 24 counties that have been open to phase 2, and I don't think they've experienced that type of concern. So hopefully that would not happen in central Puget Sound core. As far as the number, it's a little bit what I talked about a little bit, is whether these numbers go down 2 or 3, it would not affect, the fatality rates would not affect the larger decision, in part because we look at many more things other than just the fatalities. We look at the infection rate, the total infection, the percentage of hospitalizations that are associated with the disease, whether that is going up or down. We look at testing capacity. Importantly, we look at the contact tracing and isolation capability of counties, because as we've talked about, we need to have that new smart weapon that can replace the social distancing. So the numbers of fatalities is only one of the things that we look at, and I doubt just a 1 or 2 change is going to fundamentally change the assessment. But as I've indicated, we'll have more to say about that. I hope tomorrow, that is not a certainty, but I'm hopeful tomorrow to have some more to say about that. Yes, one thing is, in listening to our discussion today, thinking about our agricultural workers and what we're doing, and one of the things is this issue of masking and PPEs. And this is going to become an increasing part of our discussion in our state. I'm really glad that we're moving forward on masking requirements. And because I think the science is becoming increasingly clear that this can be a very significant part of our strategy to reduce the rates of transmission of this virus. And I'm glad that we're finding really leaders who will speak about that, business leaders and others. I had 2 Republican governors, colleagues of mine, Doug Burgum of North Dakota and Mike DeWine of Ohio. They showed some real courage the other day in speaking about the value of masking and the fact that it protects other people, and it's a demonstration of our love for our neighbors, that when we wear a mask, it's a demonstration that we don't want to infect them. And I hope that we're going to have a success on this, not just for agricultural workers, but for all of us. We'll have more to say about this in the next few days. But as we do these orders, these are orders. These are now the law of the state of Washington. But our success is going to be as much or more on our individual acts of kindness and responsibility and love for our community. And certainly masks is one of the ways to demonstrate that. Some health district county officials in the last few days have done a particular order in this regard. And I just want to reiterate that the governor is just one of the people in this fight. The success is really going to be based on the individual decisions by Washingtonians. So far, they've been fantastic. They've been on the beam. They've been committed. They've been courageous. And I want to thank people for that. I think if we keep this up, we're going to continue to beat down this virus so we can get back to our lives as we want to as soon as possible. So for that, please wash your hands.